Big welcome to everyone. Thank you so much for joining. Great to see so many people joining from all over the world, all different industries, countries and job titles there. Thank you for posting all those introductions. My name is James. So I'm a course advisor here at the University of Manchester, and I provide advice to students who are thinking of studying some of our online programs here at Manchester, one of which is our MSc in Transformative Oncology. So some of you may have talked to me before over email or over a call, and some of you may haven't. So if you do have any interest in studying with the University of Manchester, particularly this online MSc in Transformative Oncology, I'm the person to reach out to, and I'll give you all my contact details at the end of the event to talk about that course in particular. Today's event is going to talk about innovations in experimental cancer medicine here at the University of Manchester. We'll also talk about how you can get involved in that and study with Manchester and learn more about the work that's going on here, and direct your research into some of the innovative work that's going on here at Manchester. So I'm really happy to be joined by Dr. Suzanne Johnson, who is our course director for our MSc in Transformative Oncology. She's also a senior lecturer in the Division of Cancer Sciences at the University of Manchester. So it's great to have you here with us, Suze. Thank you for joining. We also have Dr. Louise Carter, who is a clinical senior lecturer and honorary consultant in medical oncology in the experimental cancer medicine team at the Christie NHS, just in South Manchester. She's also a senior lecturer in experimental cancer medicine and a unit lead on our Transformative Oncology course. So thank you very much for joining us too, Louise. I'll hand over to Suze and Louise just to maybe give a little bit more about your research backgrounds, the work you do at Manchester, and the work you do on our course.
Thanks, James. Good morning or good afternoon to everybody who's joining us today for the webinar, depending on where in the world you are. Welcome, welcome. It's great to have you along. As James said, I'm Suze Johnson. I'm the director for the programme and also senior lecturer in the Division of Cancer Sciences. And I've got quite a mixed background of experience within the oncology field. So I started off as a translational researcher and did 20 years in lab-based research, particularly interested in the interface between normal and tumour cells, and the exchange of extracellular vesicles. More recently, I've moved more into global health research with a very, very strong interest in addressing health inequalities. And I've got some research teams at the moment doing this through community engagement and working out the best way to engage with communities to understand barriers to accessing healthcare. So yeah, really, really great to have you along here today. I would also add that I'm also the unit lead for the research skills in practice module, which is the research element for the master's programme. So thank you for that, James. Shall I hand over to Louise, please?
Absolutely, thank you.
Please. Hi everyone, thanks for joining today. So as James said, I'm a senior lecturer at Manchester University, working in experimental cancer medicine. Alongside that, I work as an oncologist at the Christie, where I lead a large team of about 70 people looking at early phase trials in cancer patients, so developing a range of novel drugs. And I also work one day a week as a medical advisor for CRUK's Centre for Drug Development, where I design and deliver early phase trials. So I guess the tagline there is I'm exceptionally interested in early phase trials in oncology because I can see the real unmet need for patients and how important these are. But they're also that really exciting point where we take science and we look at animal data and we start to develop it for people. So it's that transition point that I think is so interesting. So I have a background of having developed as a medical oncologist and done training for that, but also done lab-based PhDs, doing translational medicine, to have both those sets of skills to bring to this. And I'm really passionate about developing the next generation of researchers who need to carry on sort of developing new drugs for patients because of all that unmet need. Hence joining Suze on this course and developing a module all about experimental cancer medicine. Lovely to meet you all today.
Brilliant. Thank you so much for that intro and your introduction to your research background. It's really interesting to hear some of the work you're working on. So today's session, I thought we could maybe start by talking about some of the research that you both do here at the University of Manchester, and how that is sort of leading the field of oncology research. And it would be great if you could introduce a little bit more of some of the research you've been doing, and then we could talk a little bit about how some of the people watching today may be able to get involved in this by studying here at the University of Manchester through our MSc in Transformative Oncology, and which also has a specialist unit on experimental cancer medicine that Louise runs. So it'd be great to hear more about that unit, and in particular how our students can study these areas. And then also we'll open it up to a Q&A for our participants here. So feel free, everyone, to post your questions. If there's any research questions, things that interest you, the things about the course, feel free to post them in the Q&A or in the chat function as well. I can see a lot of people have used that already, so feel free to post your questions and we'll do our best to answer those. So Suze, I'll hand over to you. Could you tell us a little bit more about some of the research that you're doing at Manchester, maybe other people in your team are doing at Manchester, and the sort of innovative and pioneering work that's going on, and why it's an exciting place to be at Manchester?
Thanks, James. And I think you're absolutely right in saying that. Manchester is really at the forefront of driving forward something we call team science. So lots of multidisciplinary groups are working together to address all sorts of different research questions regarding oncology. Myself, in particular, I'm working on an NIHR Global Health Research grant, and we are in the process now. It's taken 3 years to get to this point. We're in the process now of sending screening trucks into remote communities across Kenya to screen for esophageal cancer. So this is a really, really high mortality rate in Kenya, and largely because people are detected, or their cancers are detected at a late stage, and therefore the treatment options are much lower. So we've been working with a huge team, both in here and over in Nairobi, and also 5 different counties, to work out the best way to be able to reach these people and to be able to utilise screening in the communities so that we can improve that outcome for esophageal cancer. So that's just one project that I'm working on. But just to talk about Manchester as a whole, we're so fortunate. We have the Manchester Cancer Research Centre, which essentially encompasses part of the University of Manchester, the Division of Cancer Sciences. It's also the CRUK Manchester Institute, and of course the Christie Hospital, which is absolutely pivotal in delivering the world leading cancer care. And I'm sure Louise will be able to speak a little bit more about that in a second. What's brilliant about this course, if I may say so, is we spent quite a lot of time working out what the workforce needed in terms of oncology job roles. And we spent a lot of time talking to people who are working in the fields currently, and asking what skills they would like new recruits to have and to be able to develop, so they could hit the ground running in whichever aspect of oncology they wanted to work in. And we built the programme by bringing on board a lot of our academics and our researchers and our clinicians who are world leading experts in their areas. So the teaching is very current, it's very progressive, and it's very much research led. So everybody working at the forefront of their particular discipline, we've brought them in to share their knowledge and share their wisdom through the course materials on this programme. So it's very different to any other cancer programme out there. We're extremely proud of it. So it's great to have people here to talk about it today. And we're also evolving. We're updating, and we're moving forward with the times. And just in the last 12 months, we've developed a new unit, which Louise is leading on, which really captures her absolute expertise in the field of early clinical trials. So I'm not going to do any spoilers. I'm going to let Louise talk about that in a little bit, but we're absolutely delighted to have you on the call today, Louise.
Thanks, Suze. I guess with your question you asked there, James, about innovations in experimental cancer medicine, I do think it's a really exciting time to be working and researching in this area, because we are seeing so many new drugs coming through that are making real difference to patients, which is, I guess, the ultimate aim for all of us working in cancer. And rather than sort of 15, 20 years ago, taking a patient, say, with bowel cancer and giving them just the standard first-line chemotherapy, then the second-line chemotherapy, on they would go, we're now really, through trials, learning much more about a person's individual tumour biology and personalising our recommendations. And that's helping us make real changes for patients in terms of their outcome and survival. So for myself, I work in a large team, about 70 of us. I'm one of 5 consultants delivering early phase trials. And patients are referred to us from all across the UK for us to try and identify trial options for them. And one of the key steps we do is do molecular profiling through the Target National Study, which is a study initially developed in Manchester and then that we've developed countrywide to profile patients prior to them being considered for early phase trials. So we could look at the genomics of their tumour and therefore advise about trials that make sense, not because they have prostate cancer, but because they have prostate cancer with a specific genetic change that means this trial makes sense for them. And I think that's been a real critical change for us. We're also seeing lots of exciting novel drugs coming through. So rather than, again, just chemotherapies, although better chemotherapies are being developed, which is really important, but we're seeing lots of novel targeted agents which directly attack those pathways that are abnormal in a person's cancer, and also increasingly novel immunotherapies, so enhancing a person's own immune system to attack their cancer. And we do have cell therapies, which Suze may have a later webinar introducing one of the other modules that focuses more on that, but we're really seeing some change in all those areas. So a lot of my research focuses on developing those new drugs. But alongside that, I'm really passionate about patients having access to early phase trials. But we know that sadly they aren't reflective of the wider population at this point. We see underrepresentation of women, underrepresentation of the extremes of ages, so teenage and young adults or older, particularly older adults, sort of elderly patients. And we also see underrepresentation of patients from ethnic minorities. And I really believe in equity of access to trials. So we have a whole stream in our Experimental Cancer Medicine Centre researching that and seeing how we can increase opportunities for patients. I also think it's important we deliver those trials more efficiently and more effectively. So I do a strand of research looking at using digital technology in trials to consider how they can optimise trial design. So for example, it's estimated that one patient generates 50,000 data points in a trial, which is a lot for someone to look at and analyse and consider, but we are making decisions in a really active sense on a phase 1 trial. So can we use AI technology to help us make some better decisions is one of the streams we're looking at. So that's, I guess, where we are at the moment with our research.
Exciting, brilliant. Thank you for sharing all that. That's great to hear. Really interesting to see the sort of multifaceted approach to the research that's going on. Really cool. We've had our first question actually, Suze, based on I think it's to do with your esophageal screening work. And what is the screening method that's in place in that research?
Okay, thank you for the question. I'm going to talk very briefly about it, but essentially we are working outside of Kenyatta University teaching research and referral hospital, which is based in Nairobi, and we've equipped mobile trucks with endoscopy units. So we are taking those trucks out into rural areas across up to 5 counties. We're going to get through as many as we can in the time we have left on the project. So we're screening for any esophageal lesions or anything that might be, suspicion of being something malignant or being something that's that requires treatment. So we're taking the screening services into the community, and that's the key part and the innovation around this.
Is that so getting into the community, getting closer to the people that might have this cancer, is that the sort of accessibility issues that Louise you mentioned, is that one of the big obstacles that people are facing? Is just simply we're not getting through to people and getting them tested and screened?
I think for early phase early diagnosis of cancer is really critical, and there's a big strand of research at Manchester all about that. For the trials that I do, it is a different issue because people have normally been diagnosed with cancer for a while and had a number of treatments through their standard of care setting. So then it's the gap of why aren't trials being mentioned at that point to people? Are they not being offered them? Are healthcare professionals gatekeeping them and deciding for some reason they think it isn't right for a patient? Is it the travel to our unit? Because there is a direction of travel to try and decentralise a lot of trials. That's really hard for a phase 1 trial where you're taking a drug where you only know how an animal copes with it and you don't know what the dose is and you don't know what the side effects are. So that often ends up having to be done in a specialised unit. So people have to come to us, and that transport can be a challenge. They're very intensive, so not everyone wants to come to hospital a lot. But I think there's the way we present trials to people. Are we getting the message out in the right way? Are they widely known about this sort of trial? Do people have an odd perception of them where they think they're going to be a guinea pig and they have real concerns about them? So how do we get that message across to patients in the way they need to hear it and the information they want to know? And that's the gap. I think it's I'm not convinced that everyone gets told and given the opportunity, and I don't believe everyone should have trials. That's a personal choice, but I really want everyone to have the option to consider them and decide if they're right for them, and that's the gap we're trying to fill.
And just to add, James, sorry, just to go back as well, and Louise is absolutely right. One of the models that we followed actually for the work in Kenya was the lung health check model that we were really innovative in Greater Manchester. So this was literally taking trucks into supermarket car parks because we were aware the demographic of individuals who weren't coming forward for screening or weren't presenting with early symptoms in lung health. And the number of early cancers that were detected with that is quite staggering, just by taking this ability to screen into a normal, environment where somebody might be. It's traditionally the males who weren't coming forward because they're not so good at health-seeking behaviour in general. So bringing them into a supermarket environment where they might, be shopping out for the day, or they'll just pop in and have a check. And it's been so incredibly game changing in terms of the detection, and that scheme has been rolled out across the UK. So it's almost using that model to access the individuals and make it more normal and more acceptable and more, part of normal health checking and more normal, taking control and taking sort of empowerment of your own health and seeking those health health opportunities, to be able to get those checks really early. And it really will be progressing the sort of move towards early detection and then more successful treatment options for those patients.
Absolutely. Does by early detection and having more patients, that you're obviously is going to increase their treatment options and possibilities there, but does it also support research that you're doing, so you're getting a bigger picture of that cancer life cycle, they're getting data from early stage cancer right through to late stage cancer, which you might not have had previously by not having that patient set?
Yeah, absolutely. And the sort of sample collection part is only one aspect of the reasons why it's important to engage with communities in a really authentic and sustained way. But you're absolutely right. If we don't have that broad demographic which represents the communities we seek to serve with our research, if we're not able to have those samples, we can't do the genomics, we can't do the testing. And as we move towards personalized medicine, as we move towards precision oncology, we need to understand those underlying genetic signatures to make sure that we're matching the patients, as Louise said, with the right treatments and the right drugs and the right opportunities. I don't know, Louise, maybe you want to talk a little more on that.
I guess maybe I'll talk about one exemplar programme led from Manchester that I think answers a lot of these elements. It answers both the underserved groups of patients and how to personalise treatment. And that's a study called Determine, which is for patients with rare tumours, because traditionally, sadly, patients with rare tumours have less treatment options than those with common tumours. They have worse quality of life and really sadly have a poorer survival because of it. And that's because traditionally they've been considered hard to research because each individual is rare. But if you group them all together, they make up about a quarter of all cancer patients. So we cannot accept that a quarter of all cancer patients have worse outcomes just because of rarity. So Determine is a programme that one of my colleagues, Dr. Matt Krebs, has developed and led at Manchester University, which is a clinical trial taking licensed agents in unlicensed indications. So drug companies may go and do a trial, for example, looking at targeting an alteration such as HER2, which people might have commonly heard of, being targeted with Herceptin in breast cancer, because breast cancer represents a really big potential market, and drug companies do have to recoup their costs. But what about a small market like salivary cancers, where we do see changes in HER2? would they benefit from Herceptin? We don't know the answer to that without running trials. So Determine takes patients who've had molecular abnormalities identified in their cancer, through, for example, the Target program that I mentioned, and who have rare cancers, and we try and match their alteration with a specific drug on that's being tested to see if they would benefit, with the eventual aim that these drugs will go on to the Cancer Drug Fund and be available for patients in England to receive in the future if we show benefit to them. So I guess it's a nice program showing kind of the equity of access, because actually your tumour type can determine that, and also personalisation of medicine. And it's also a nice example of team science, because it not only has centres across the UK, clinical centres working on this, but there's also a big translational piece going alongside, led by Gary Middleton from the University of Birmingham, where they're going to try and learn more about these cancers to develop better treatments in the future, and look at that resistance that develops, to see if that identifies novel combinations of treatments for the future. So it's a really exciting program. And there is a website for Determine, so you can Google Determine CRUK, and you find that if anyone was interested in it.
And actually, we were absolutely delighted because Matt did record some content for us describing the trial, and we did a bit of a Q&A with him as part of the learning materials on the programme. So that's fantastic. And also, just to add in at this stage as well, because some of the people on the call might perhaps not realise, but so one of my other hats is the Director for Social Responsibility for the School of Medical Sciences here at the university. And social responsibility is one of our 3 strategic goals for the university. And the aspects that we're discussing here now, the equity of care, addressing health inequalities, engaging communities, all of those different aspects and all of those strands, they're really strongly woven through all of the content that we have on the programme. And that's something that I was absolutely determined to make sure it happened, but it wasn't too difficult, because the majority of the colleagues that I work with actively involve this kind of ethos in their work, naturally anyway. So we really wanted to bring that to the fore, so that people understood that it's more about the patient individually, the cancer individually, and making sure that engagement aspect and the sort of recruitment and everything else is done as equitably as possible. So it's really a very distinctive flavour to the programme to be able to have that aspect of it.
Brilliant. Well, on the topic of the programme, the course that you run, Suze, I think this could be a great opportunity to talk a little bit more on that and give our audience a bit of a introduction, or possibly further information from what people have seen already about this course that Suze and Louise are involved in. So we offer a full MSc programme online in Transformative Oncology, which is a part-time master's programme which you can study alongside your work or your other research commitments. And our next enrolment is in September this year. So if you are interested in exploring your opportunities to study some of these research directions, some of these topics that Louise and Suze have introduced today, this is a great opportunity to, wherever you're based in the world, wherever you are in your career, to study alongside what you're doing and really specialize in some of these areas. So Suze, I'll hand over to you. Would you be able to give us a bit of a more detailed understanding of what this course is about and how it can benefit some of the people on the call today?
Yeah, of course. So as we've kind of touched on already, this really has been written to be quite pioneering and patient focused. So it brings together not just the excellence of the leading institutions that we've talked about. So we've got CRUK Manchester Institute, we've got the University of Manchester, and we've got the Christie Hospital, and it brings those leading excellent experts together to really help to equip our learners with the skills to actively transform outcomes for patients with cancer, and that's really key. There are flexible pathways through the programme. You can access it just as a postgraduate certificate, which is 4 units. You can do a postgraduate diploma, or you can do the full MSc. And typically we say that the full MSc you can do across 3 years. It does take some commitment to study time, but it's a kind of a learn while you earn kind of model, because the majority of our students are already working professionals, but they're looking to upskill with very specific skills that will move them into their next role, or move them perhaps into a leadership role. It is all based online, so there's a study with a whole wide range of different engaging online resources. So we've got lots of videos and lots of interactive learning activities, and it's very future focused. So we're able to provide the global campus essentially with access to our leading experts from Manchester. So you're hearing the voices, you're hearing the stories, and a lot of the units can contain not just kind of traditional taught lectures, but actually more of the kind of things we've been talking today. So you're seeing those insights, you're seeing those decisions and how those decisions came about based on the research that our academics have done. And it's also a really fantastic opportunity for our students to meet a global network. You know, we've got access to people all over the world. At the moment, we've got in our final year, for example, we have a radiographer in Uganda, we have a clinical trials coordinator in the UK, we have a GP in the UK as well, we have someone who's working for the World Health Authority, who's in Kenya. So we've got a really global feel, and you know, there's a real rich experience for our learners because they can learn about different healthcare systems as well as different approaches to doing their research or their clinical activities. So I don't know if you want, James, would you like me to do a bit of a breakdown of the specific units involved, just briefly?
Absolutely, yeah. Please do share that.
Okay, so just talking a little bit about the study pathway or the sort of, you know, the structure of the programme. For the postgraduate certificate at the moment, we're offering 4 different units, and these basically cover the tumour, the patient, the treatment and the specialities. So understanding the challenges of tumour biology is really about understanding tumour diversity and how this might impact on treatment and detection of those tumours. So we cover things like tumour heterogeneity and why that's important to understand that, toxicity, and also rare tumours. The next unit is led by Professor David Wedge, who's an expert in cancer genomics, and this is all about cancer being an individualised disease. So this is about appreciating cancer patients as individuals and looking at the contributions of any underlying health, genetics or lifestyle components for that individual. And it's about the impact of genetic diversity, perhaps, you know, comorbidity, and also molecular and lifestyle variability. Our third unit is around the treatment. So this is established in experimental therapeutics. And this really helps to outline the present, but also the future of cancer care, treating every patient and every cancer and every patient individually. So it's about drug discovery, it's about targeted therapy, and it's also about looking at ways to repurpose drugs. And Louise sort of alluded to this earlier as well. And then the final unit for the PG Cert is around the branches of oncology. So this really takes a deep dive into all the different approaches to treatment in oncology. So whether that's medical oncology, clinical oncology, or surgical oncology, and of course they all work in concert together. So that you know, sort of is composed is the postgraduate certificate. And if you choose to move on to the postgraduate diploma, we have now we have more options available to you as well. So you can really sort of chart a more flexible pathway with your learning based on your choices. So here we talk about, you know, the cornerstones of cancer treatment in radiotherapy. We talk about strategies for early detection, so, you know, effective use of imaging or medical tools and technologies to aid early detection. So I got my words mixed up. Understanding advanced therapies in the cancer setting. So this is all about the scientific, clinical, and also the regulatory processes that are involved in manufacturing advanced therapies and medicinal products. Principles of personalised medicine. This is all about getting an understanding of the stratification of cancer risk or response to therapy. It looks at molecular alterations and how those are detected, treatment stratification, and also touches on drug resistance. Delivering the best cancer care is all about establishing the efficient and effective clinical pathway to deliver optimal results, and this really incorporates a lot of the patient perspective, and certainly, you know, covers a lot about treatment planning, and also, as we've described before, the importance of those multidisciplinary approaches. And then the final unit that on the list today is experimental cancer medicine, which I'll let Louise talk about in a few minutes. And our research element, which is studied in the third year, is research skills in practice. This is the 60 credit aspect. And during this, we all of our students actively get the opportunity to really refine those professional skills. So it's covered in 6 modules, including how to formulate a research question, how to critically appraise the literature, how to design a study methodology. But it also touches on things like ethics and responsibilities as a researcher, tips and skills to communicate your research. And throughout the whole programme, we also incorporate a lot of skills around reflective practice. And this is really, really important, both in science and in medicine, because we do this often. We reflect on what we've learned and how we can move forward with that information. And it's a really important skill to help our students to master. So that was a bit of a whistle stop, lots of words. We've got, these can be available, the slides can be available, and obviously there's more information on the website. This slide is really just a snapshot to try and help you to think about where this course could take you. There's 3 main strands, so there's research, or there's healthcare, and then there's more administrative. But we just put a few job roles on there just to try and give you a flavour. So many of our graduates will go on to stay in academia to continue with a PhD, for example, or they might choose to work in biotechnology or a contract research organisation or a pharmaceutical lab. So in terms of healthcare, this could be either patient facing, so this is working in a hospital, working in a private clinic, or working in a community clinic, and we've got people who work in all of those as students currently in our current cohorts. Also in services, so is it around diagnostic, is it lab management, is it diagnostic and screening services that sit behind these sort of patient-facing clinical services, and is it data analysing? Louise again just touched on this earlier, just the amount of data which is generated from each individual at the moment. We need to start training our workforce to be able to manage that data and efficiently analyse it, and maybe something like a centre manager. But of course, there's another aspect of this, which is administrative, which can talk about things like science policy or marketing. The importance of being able to communicate some of these really complex messages into something which the layperson can understand and then respond to. And of course, all research is funded through medical research charities or other funders. So there's lots and lots of job roles there that would, that would really benefit from having somebody have this really deep and broad understanding of the oncology sort of pathway.
Brilliant. Thank you for that overview there, Suze. It's great to get that detail on the course that we offer. There has been a couple of questions which we will get to at the end of today's session. So within this course, we offer an exciting unit that is headed up by Louise in experimental cancer medicine. So it's a really exciting opportunity to learn a little bit more about some of the work going on in this field. So Louise, would you be able to give us a bit of an overview of this unit? I'm really looking forward to hearing more about this, and I'm sure some of our participants are too.
Thanks, James. So this course module is similar to all the others. It's 6 weeks of taught content, then 2 weeks for the assessments. We go to the next slide. And why is it important? Well, we need better drugs, bluntly, for cancer patients. And so that starts at this real point where we take animal data and turn it into data in people. We not only need more effective drugs so we are curing more patients, but we actually need more tolerable drugs, because many people are living with cancer and we want them to be able to lead full lives whilst having treatment alongside that. So we need to develop all those drugs through oncology trials. And oncology trials are a bit unique versus many other fields, because we trial our drugs in oncology patients, so people living with a terminal diagnosis usually, and therefore balancing all those additional emotional and physical elements for the patient alongside being on a novel drug. In, for example, many other specialties, they often use healthy volunteers in a phase 1 trial. So it is a unique group of patients we bring forward into our trials, which I feel is really rewarding, but does add additional challenges to our trials. And those are some of the elements we discuss in this module. So I think this is hopefully relevant to many people who work in oncology or cancer research or drug development. I think resident doctors or fellows who are interested in careers in oncology or learning more about drug development, who might want to go into the pharmaceutical industry, would be ideally suited by this course. But actually, oncology is a multidisciplinary team, so all the allied health professionals, so working in radiotherapy, for example, nursing staff, all these elements. I think if you're a chemotherapy nurse, have you ever wondered how the dose that you give is assigned, not just for that patient, but for all cancer patients? How do we work out what dose we should give of a drug? I think scientists working in cancer or drug development would be well suited. And also those wider specialties that Suze was mentioning, so people who want to work in pharma or CROs would again need that sort of foundation of understanding trials that this helps develop. So the course itself is, as I said, 6 weeks. So first we have a general introduction into early phase trials in oncology. So we start to understand the terminology associated with them, the different phases of trials all the way through to licensing a drug. And really importantly, as Suze highlighted, the ethics of trials, because that's a really critical area. In week 2, we look at some of those key elements of early phase trials. So how do you decide what side effects a patient is experiencing? And how do we do that in a standardized way? So that for a multinational study, when I'm sat in Manchester, someone sat in Hong Kong is assessing the drug in the same way so that our data is comparable. And how do we decide, similarly, if patients are benefiting from drugs and therefore we're at an effective range for that drug? Again, we need to standardize that. Week 3 is a really deep dive into trial design. So how do we work out what dose of a drug should be used? What's the trial designs that help us do that? How do you work out what group of patients will benefit from a drug? All these different elements of design of trials are covered. Week 4 is looking at pharmacokinetics, which is really critical for our trials, because we need to know how drugs are absorbed, how they're distributed through a patient's body, particularly into their tumour, which is our sort of area we're trying to get through, then how they're metabolised and excreted from their body so they're no longer giving them side effects. What other drugs interact with that drug? What can't you put alongside? If you've ever opened and looked at a sort of inside your packet of paracetamol, it will give you a lot of side effects about the potential, but it also might tell you drugs you cannot give with it. So how do we work that out? We work that out often through pharmacokinetics in an early phase trial. Now, week 5, we sort of go back almost to the start, and how do we take animal data and turn it into a trial? What data do you need to safely open a trial? And if you're looking at a load of animal data, so you've got some data from rats and you've got some data from dogs, how do you decide what dose the first person who gets that drug should get? How do you decide what a safe starting dose is? But not only safe, but ideally getting into the realm of effective, because the person going on that trial has cancer. And then lastly, week 6, we look at translational strategies. So how do we use all that additional pharmacodynamic data we generate about the drug to help us work out what group of patients, what dose level, what combination of drugs, and to really design better trials. And then we have 2 weeks of assessment where we try and learn about how trial design has changed over the years. We look at things like patient-reported outcomes. How do we get the patient voice into our trials? And we consider trials that have, sadly, a trial that went wrong a number of years ago that was really pivotal in changing how we do things now. So we have far more effective trials that deliver far better outcomes for patients. And that, in a nutshell, is the course. I think the opportunities obviously are learning about how we develop novel drugs, and hopefully from hearing from a wide range of experts in early phase trials and the translational work we do alongside. But as Suze highlighted, that kind of chance to interact with your peers and learn about different fields. I was really interested to learn about trials in Jordan from one of my students in the most recent one we did, which was something I just wasn't aware of how their system worked. So that was really interesting for me, and I was learning. And hopefully to develop career skills to advance their careers in both cancer and drug development. So that's, in a nutshell, this module.
Brilliant. Thank you so much for that, Louise. And yeah, thank you for sharing all that information. We've had a couple of questions in the chat about the course. So let's start with the one in the Q&A. I think part of this I'll answer, Suze, but then maybe I'll hand over to you to answer the part on the research project, if you would be able to help with that. So the question here about, can I complete the course in 5 years on a modular basis, or would it be better to do a PG cert and then come back and do the remaining modules? So I would advise in this situation, it might be kind of case by case, but you do get up to 5 years to complete this master's degree. You can complete it quicker than that. There is a schedule that takes 30 months to complete, but you can take up to 5 years to complete it. So that would be an option for you. That's probably the best route to go on, but it might be best to email in and just share a bit more information about your situation, about how you might want to navigate those 5 years. But yes, you can complete the course up to 5 years. And then there's a question on top of that, Suze, about the research-based project. So is this a 10-week lab-based project, and could it be clinical-based?
Okay, thank you. And thank you so much for the questions. Really, really important questions, actually. So I think, so to start with, you can absolutely study over time, part-time. So it's a part-time study anyway. We recommend 4 of the units per year, so that's 60 credits of learning per year. And just to specify, because I think there's another question related to this as well. So as Louise described, we have 6 weeks scheduled online learning, and then there's 2 weeks for the assessments, and that's the same for each 15 credit unit. So there's a period of 8 weeks of study. Now there's flexibility in that, because you can access those learning materials at a time of day or a time of week which is which is suitable and appropriate for you if you're working full time, etc. But we do like to keep the cohorts together as much as possible, because we have a lot of interaction with discussion boards, and we also do include some synchronous tutorial opportunities as well, so you can actually come and talk to us and the academic team. So there is a structure to it. Now, what we're trying to do is to enable our students to be able to have flexibility in their choice of those units. And if you want to do a PG Cert, for example, if you wanted to do that over 2 years, it would be possible for you to do two units each year, if that makes sense. So it would take you the 2 years to do the 4 units, and that would make a PG Cert. That's possible. You can then graduate at that point if you want to. You can then come back if you wish to, or you can look to increase your sort of learning and go on to do the postgraduate diploma and the research element on the back of that. Just to talk about the research element a little bit. So at the moment we schedule that for the full year. And the way it breaks down is that we've got 6 different modules, and I think I kind of reeled off those quite quickly earlier. We've got 6 different modules, and the assessment for those modules is done throughout that year. So rather than the traditional, 10 weeks or whatever it is in a lab-based environment, and then you write a big dissertation with lots of words and lots of, depth and a lot of writing involved, what we've done with this program is we've sort of chopped it up into six modules so that the assessments can happen through the course of that year. And that's a lot more manageable. It's a lot easier for students to manage, so you've not got this big dissertation at the end of the year. We are working with our partners in the Christie, and we are working with our partners in the Patterson or the Oglesby Cancer Research Building to develop opportunities for our students, if they want to come to Manchester, to be able to engage with a research project, if that's what they want to do. At the moment, it's not. We don't have capacity. We're so popular. We run different cancer programs as well, which are face-to-face programs, and those students are prioritised for those face-to-face lab-based projects. However, if there's a connection in particular with one of the world experts, if you're really, really keen and really interested in a particular strand of research, please do feel that you can have that conversation with myself and with the expert as we go through, and we're always flexible to see what we can manage. There would be an additional charge for that, because there would be some bench fees, and all that we'd take into account when we had that conversation. So I hope that kind of answers the question.
Yeah, brilliant. Thank you, Suze. There's another question here. Can the course be done completely online? And there's a question about the 6 weeks format. So yes, the course it can be done completely online from wherever you're based in the world. The 6 weeks that Louise had with her unit there, that's the taught aspect of that particular module, followed by 2 weeks of assessments. So that's for one unit, not the whole course itself. There's several modules that you'd need to complete, followed by your research project at the end if you wanted to complete the MSc. So that is just the 6 weeks of teaching for one individual module. There's a question here There's a couple of questions about funding and scholarships, so I'll just try to answer all these in one. So in terms of this being a fully funded program, there is some scholarships available depending on the country that you're from. However, if you haven't applied for that already, the deadlines will have passed for that. So in terms of if you wanted to look into that scholarship opportunity, you would need to be looking at 2026 entry, not 2025 entry. There is also a question about staff discount, so 50% staff discount. So I think this is from University of Manchester staff member. Get in touch with me. I'll give you my email address at the end of this. That's something we can look into because there is opportunities there, but I would just need to confirm with finance teams on that. So do get in touch by email and I'll try and give a more firm answer on staff discounts for you there. And then there's a question here to Susan and Louise, both could probably cover this. So it's how do you think this MSc could help in the practice of cancer surgery? So is there any particular units or content on this course that has some relevance to that field?
Yeah, thanks, James. And thanks, Manuel, for that question. It's probably really, really important to reiterate that this is online learning. So when you talk about the practice of cancer surgery, there isn't going to be an opportunity for you to be there in person to sort of engage with that, the application of that. However, we do have a component of the branches of oncology, which does cover all the innovations within surgical oncology. So you will lead, so and that unit actually is led by a surgical oncologist, Bilal Al-Kafaf, who's globally known actually for his innovation within surgical oncology. And so you'll be learning the theory, you'll be learning, you know, the research and the current thinking around surgical oncology, but it wouldn't necessarily, you wouldn't have that sort of hands-on opportunity.
Yeah, that makes sense.
Sorry, James. There was another question that just came up actually that I was just going to answer if that's okay, which is, can we have face-to-face summer school and internship in oncology field? There's a really, really exciting development, which we're not quite ready to reveal as yet, but we are working at the University of Manchester. We have really close partnerships with international centres, and we are working in the background at the moment with this programme to look at ways that we can bring some of our academics and some of our teaching out to some of the individuals in the sort of, you know, on our global campus within these centres, so that we can do some of these face-to-face masterclass opportunities, almost like a research symposium. So that's very much in the pipeline. It's not something we can offer this coming year, but we're hoping in the next year or so that those relationships and that, but you know, that will all be worked out, and it's something that we'll be able to offer our students. So it's an exciting time for the programme.
Absolutely. Yeah, thank you, Suze. There's a couple of questions related to PhDs, so I'll just answer that. This we're not able to give advice on PhDs in this session, but if you are interested in PhD projects at the University of Manchester, go on our university webpage. You can search for projects on there to find something that might maybe in a relevant field. If you're looking to work towards a PhD, certainly doing a master's degree could support that. So this might be a good option. You get to know some of the academics, you know, perhaps in the future, who knows what might happen, but unable to give you any firm advice on PhDs. I'd recommend you look at that on our university webpage to find a relevant project for you. There is a question about assessments. So how are the modules usually assessed? Is it multiple choice questions, essays? What can future students expect?
Yeah, so we assess using 3 different modalities, and each 15 credit unit is assessed in exactly the same way. So there are some multiple choice questions, which is an automated, you have access to the questions for 45 minutes, but you have a 24-hour period in which to do that. So it still enables the flexibility of engagement. We also have a comprehension question. So this is a question that's set by our unit lead, which really covers and looks for evidence of your learning across all of the aspects that are within each unit. And then we have a reflective portfolio. So this is about you thinking about your learning and thinking about what you've learned, how you might apply that to your working world. and also putting together a sort of action plan for yourself for the coming units and for your coming learning environment. So we assess each of the 8 units in exactly the same way.
Brilliant, thank you for that, Suze. There is a question about, is this course only done by individuals who are attached to cancer centres or research organisations, or is it also done by individuals? So yeah, is that the possibility?
Yeah, so not entirely sure what you're getting at, but I'm going to try and answer this, and hopefully we'll give you a flavour of what we mean. So this is a master's degree, master's level programme, and it doesn't start off with the very basics of cancer. So you do need to have an introductory, familiarity with cancer, perhaps a little bit about genetics, from which you will have got in your first degree in your BSc, etc. In terms of whether you need to be someone who's already working in the oncology field, not necessarily. It could be someone that you're in general practice, or you're someone who's working in a sort of scientific institution, or a lab-based diagnostic lab, for example, but you're interested in progressing into the oncology space, and you need a little bit of that extra depth of understanding for you to be able to apply for those jobs or those roles within that organisation. So the professional skills development aspect of the programme, it includes everything from communication, critical thinking, but also things like team working and time management and intellectual curiosity. That's what we really, really want to encourage our students to engage in. And, the other aspect of this programme that we perhaps haven't mentioned as yet is the beauty of it is really looks at that synergy between science and medicine. So, for example, if you're medically trained and you're interested in pursuing a career as a clinical academic, conducting research in oncology, you'll really benefit from understanding some of the basic science methodologies, which will help you to plan projects and write grant proposals and conduct investigations in your own right. But on the flip side, if you're interested or you're wanting to pursue translational research or develop diagnostic platforms, for example, so you come more from a scientific background, it's hugely, hugely enriching to understand and appreciate the potential clinical application or the impact of your discoveries and your experiments and your investigations. And I can say that with absolute experience. So when I was doing my PhD and a lot of my postdocs, I always had a clinical supervisor and also a scientist supervisor. And that sweet spot between their expertise and that understanding about how those two worlds meet and have to meet as we move towards precision oncology is so, so valuable.
Brilliant. Thank you, Suze. We've just got time for one more question. So I'll try and merge 2 questions into one here. So there's a question from a neurosurgeon who is interested in glioma of the brain and spine research. Sounds quite a specialist area. I'm not sure, Susan, Louise, how much experience you have in that area. But there's also a question from an endocrine oncologist and how this course might help in a clinical basis for someone in that role. So 2 different job roles there, but is there something in the course for people in these positions? Is there anything you might be able to share with us related to those areas?
So I'm going to invite Louise, who is the clinical partner of the 2 of us here today, who might be able to shed a little bit more light on that, if you don't mind, Louise.
So yes, I think it doesn't matter what your area of interest is in oncology. I think the course adds to it because you get to have that sort of building on the biology of cancer, which is important no matter what cancer type you're interested in, that building of all the different types of therapies, which again will be relevant for both gliomas or thyroid cancers to understand those, and sort of optimizing practice, which again is relevant across all. So I think both actually endocrine and neurosurgical areas in cancer are really fascinating areas, again, of growth and exciting drugs coming. But I think this course could add no matter what aspect you're coming from. I think if you're working in a district general hospital, I think to one of the prior people's questions, you could still take a lot of this learning back to your practice there. So I think it can help you both clinically or from a research perspective.
Brilliant. Thank you, Louise. Thank you for all those answers, Susan, Louise. Yeah, that is all the time we have for questions. We're getting towards the end of today's session. But do get in touch by email. If you have any other questions that you would like to ask, feel free to email me at studyonline@manchester.ac.uk. I'll just post that in the chat as well. Yeah, we try to get through all those questions, but there's quite a lot. So please feel free to email any more that you have. Also, if you have any interest in our online MSc in Transformative Oncology, feel free to email me at studyonline@manchester.ac.uk. I'd be happy to answer questions about that, about the course, about how to apply. And it would be great to see if some people in today's audience would like to learn more about that. You can also visit our course webpage. The link there is at the bottom. So if you go to manchester.ac.uk/transformative oncology, you'll be able to find our course webpage. There's lots of more information about how you can apply, how you can get funding, the cost of the course, the formats, all these kinds of things that you might need to know about that. There's lots of information on the course webpage there. There is a few more questions coming in, so do please email these across, and I will do my best to get some answers for you on those. In terms of today's session, that is the end. It's great to have so many people joining. Really appreciate Louise and Suze, your time as well. Thank you for answering all those questions and sharing some of the work that you've been working on and some of the opportunities that people have here at Manchester to study some of these topics. So a big thank you to everyone joining us today, and there'll be a recording of the session sent out to everyone, so you'll be able to watch it back, and feel free to get in touch. If you have any further questions, you've got the contact details there. And thank you, and have a good day, everyone.
Thanks, everybody. Thanks, James.